All right, Amy, why don't you just tell me a little bit about how you were feeling before you came to New Life Source Chiropractic, and it's been, what, about 3 weeks now?
I think this is the third week of treatment.
Okay, great. So again, you came in, and how were you feeling? And
I was feeling extremely depressed. I mean, I'll try and put on the face that I had when I came in, but I came in, and that day I just felt like I couldn't face the day or get out of bed. I was just, and I had invited Leslie, your wife, to go to Pilates with me, and I called her up, and I was crying.
Oh, goodness.
I just woke up, and I was crying, and
no reason
whatsoever. I mean, it was a regular school day. I was supposed to get Matthew to school and go to Pilates,
right,
meet a friend. I mean, fun things.
Right. It wasn't like you had a funeral to go to or anything.
Right. It was a regular fun day, but no day had been fun for 9 months.
Oh my goodness!
I've been so depressed, and so Leslie barges into the house and brings coffee and croissant.
She does do that.
Yeah, and that's okay. She's a good friend.
Yeah.
And she said, "I don't know what we should do. Let's do something. Let's go over to Chris's chiropractor, and you can see that." And I said, "Sure, I'll try anything." She goes,
"I'm game."
Take some of this blue-green algae stuff.
Right.
That really helps, And she was anyway. I feel this is the analogy that I had this weekend, because this is the 4th day of not being severely depressed.
Wow.
And
how many months now has it been?
9 months.
That's amazing.
It's like being pregnant, but there's no baby at the end. But at least
That's right.
I literally
you're the new life.
Yes, I'm the new life, right?
That's right.
Because I literally feel like I've been let out of jail.
Wow.
I'm in menopause. I'm 53 years old. I'm an older mother. I've got an 11-year-old, that I talked about earlier, and I've got a daughter who's just graduated from college, and my dad died. My youngest brother passed away, and so we've had a lot of life things that have been harder to deal with. But I just 9 months ago, I just dropped out of life, and I had no interest. I take an art class it's actually sort of an art league. It's from 10 to 3 at an artist's home, and we all just get together and paint and have lunch. And I was really enjoying that because I was an art major at Tulane.
Yeah.
And it was. And then all of a sudden, once I got depressed, I looked at my paintings. And now I can look at them and say, that one's pretty good, but that one's not so great. But they were all hideous to me. And I was saying, and my psychiatrist was saying, you should really go back to your painting class. And I said, you know what, I really like to do artwork, but right now I just can't do it. And if people aren't going to really love my paintings and want to buy them, at this point I just feel like there's too much in the world to junk up.
Right.
And so I said, I just can't do it. I kept calling, her name is Nancy Pruden, and she's a local artist, and I kept calling her saying, okay, I'll be there on Wednesday. And then Wednesday would come and I'd have to call her, and it was embarrassing because she's a friend, but I don't know her well. And one day I just called her and I just burst into tears, and I said, Nancy, I'm sorry, I feel so bad, I just can't come.
Wow.
And she was very sympathetic, but now I'm talking about it. I haven't started because it's been only 4 days. I've been celebrating,
So you were talking about veil? You felt like you had so many veils over
I
you?
had 10 veils over my head. I'm getting off subject here.
No, that's good.
And I had 10 veils over my head. They're heavy black veils. It's not like a burqa,
Right.
There wasn't even any.
Like a canvas, heavy.
Yeah, right. And I feel like today, probably about 7 of them have been lifted.
That's incredible.
Yeah, and
it's a big improvement.
I've had maybe even more than 7. Maybe, I just, I felt better, I had better days during this depression, but I've never had 4 good days. So I'm counting all good days.
That's sweet.
And people are telling me to have an affirmation, because if I say they're going to keep being, but I'm going to keep counting the days till the day I die.
There we go.
And just how many good days there are. Hopefully I'll live to be 115, but...
Or you're on the way.
The oldest woman died at 115.
That's your goal.
That's my goal.
There we go.
Now, and I wanted to die
before?
2 weeks ago, before I came to your office, I was like waking up. First thing I do before I even had a cup of coffee or a glass of orange juice or anything was burst into tears over nothing.
No reason, just
No, just depression, just pure, simple depression. And it's so frustrating because I had gotten to the point where I was really mad at myself.
Right.
I mean, I know there's something called clinical depression, but it's personal.
Right.
I mean, and I was just like, you are 53 years old. Why can't you have a wonderful life? You have a nice house. You have a nice husband. You have 2 healthy children. Why can't you even get yourself out of bed and take your son to school and go to Pilates class?
Right.
I mean,
that's
people
not too much
would
to ask.
kill.
Right.
People would kill for that life.
It'd be a dream day for anyone else, and
Right.
it was.
Yeah. And so I just, Dr. Kay and what you guys do here, I mean,
That's
it
correct.
really, really works.
Well, we thank you, and this is going to be inspiration for a lot of patients because so many, like I was telling Amy, 30 years ago when patients would come in, they weren't suffering from depression, high blood pressure, diabetes, digestive issues, and thyroid and all these metabolic dysfunctions. But virtually every patient that comes in here, primarily they come in for pain for their back, but they've got all these other situations as well. They don't know that what we're doing can actually address the immune system, which affects every function and disease that we have. And
no kidding.
You're a great example for that.
Well, I'll just tell you more then, if you want to
Okay.
hear a little bit more, is that I also have high blood pressure. It's treated with medication.
Right.
But it runs in my family or whatever
Right.
reason I have it.
Predisposition
I was
towards it.
Yeah, predisposition. And I was 37 when I was diagnosed, which is
That's
quite
very young, very young.
But my
and you always exercise, and you haven't had a weight problem, and you're
exactly.
not
So
right,
I'm
not smoking, and
I'm not
right.
smoking. I try not to
Eat organic
drink too
food,
much and,
right, you
I
do
try
it.
and eat healthy and
Right.
and exercise and all that. But yeah, my mother and her 2 sisters, my aunts, all have it.
Right.
So it's some kind of inherited thing. And my mother came down with it in her 40s, and my aunt came down with it in her 30s. So it was anyway that's been treated because you can treat it, and there's not
Right.
that many side effects with the drugs.
Right.
But the depression is the thing that I couldn't live with. I can live with treated high blood pressure. I can't live with depression.
Yeah, that's.
I mean, I can live, but it's no quality.
You're just existing.
Yeah, I was just a
Barely getting
useless
by.
blob. A useless blob.
Well, now you're an effervescent blob. So we. Well, thank you so much, Amy, and thanks for sharing too with others because it's people like you who have a great experience, and then they're able to communicate with people who don't know that what we have to offer. And I was telling you before, a lot of chiropractors, I didn't know a lot of the things that Dr. Krennic is doing can make a difference on these different levels. So we appreciate it.
Okay, great.
Bye now.
Yeah.